I'm going to be talking to Dr. Joe Vipond, who is a Calgary ER doctor and has been a very outspoken critic of the Alberta government's COVID-19 pandemic management policies and practices. And he's going to be responding to a video that surfaced over the weekend, an interview with UCP caucus chair Nathan Neudorf, who's a Lethbridge MLA, who said some very interesting things about how the government thinks about COVID. So welcome to the interview, Joe.
Thanks for having me on again.
Well, look, I'm going to start off with a quote from Neudorf, so bear with me here. He says, in the UK, we also saw a rapid rise of case numbers, but then an equally rapid decline as it finished going through the unvaccinated population. It didn't have anywhere else to go. So I'm very hopeful that we will see the very same kind of trend, maybe a bit of an accelerated case rate, but then a very quick decline as well, allowing us to safely keep businesses open. Basically, he's being criticized because he's saying, we're going to let COVID go through the unvaccinated population without doing anything.
Yeah, so basically what the government seems to be saying here, and we've had, kind of suspected this for a while, ever since, late June, when they've announced the lack of any mitigation policies, is they want to create herd immunity here. It's this concept of the Great Barrington Declaration, whereas if you let it rip, for lack of a better term, through the population, you're going to have, and you protect those that are the most vulnerable, which are the elderly, you're going to create herd immunity, but not a lot of disease and destruction. This is all pre-Delta, these ideas, and no country in the world, including the UK, has successfully enacted this herd immunity concept. So this is truly an experiment. And any place in the world, including Sweden, including Brazil, who's looked to achieve herd immunity has failed, and as a result have had huge morbidity and mortality from that. So we're seeing our hospitalizations, our hospitals and our ICUs fill at the moment. So it's really worrisome.
And what I'm hearing from Alberta, particularly on social media, is parents are concerned because the original version, the alpha variant or version of the COVID didn't infect children, but the Delta variant is. And that parents, with school opening up in a week or so, parents are terrified that without any kind of intervention, without any government policies to help school boards and schools manage this, that their children are going to be at risk. Yeah,
and just to clarify, I'm sure Alpha and the original variant were infecting children, but there was a lot of asymptomatic cases. And so, when you heard stuff like, we're not seeing transmission in our schools, a lot of that was probably just the fact that a lot of kids had the virus, but weren't symptomatic with that. And now with Delta, we're expecting to see more of that symptomatic disease and possibly more hospitalizations and intensive care unit admissions because of that. That's what we're seeing in the Southern United States with Delta. So the big problem here is that the 0 to 12 age group doesn't even have the option of getting the vaccine. So they cannot be protected from this. And just to further that, we know about 8 to 13% of kids will get long COVID, even if they have mild infection. And so the real big concern is like 8 to 13%, that's like 1 of 10 infected kids go on to have a long-term disability. That's devastating. It's a huge experiment on our population.
Well, a number of weeks ago, Dr. Dina Hinshaw, the Alberta Chief Medical Officer, said publicly that their modeling was originally based on UK assumptions, but then her modeling team realized that they didn't really apply to Alberta, and the better comparable was the southern US. And it seems there's a disconnect here, because here you have the caucus chair of the UCP saying, yeah, we're basically following the UK model, and the chief medical officer saying, no, that doesn't apply. That doesn't make sense for Alberta. What do you make of that?
Well, I mean, the other thing that they said is that vaccines have basically, quote unquote, defanged COVID, so that there's a disconnect between the cases per day and the hospitalizations and ICU admissions. I think it's clear that deaths are now disconnected from those cases, but we actually have higher hospitalization rates and higher ICU admission rates per cases per day than we did in an equivalent period in the second wave, which is the last wave, which is, where we started close to zero and ramping up. Third wave is a bit different. So instead of being defanged, Delta has actually, made things worse. And it's not surprising, because guess who hangs around unvaccinated people? Other unvaccinated people. So it doesn't matter what percentage of the population is vaccinated if all the unvaccinated people are hanging out together. And that includes, 5-year-olds hanging out with 5-year-olds and 10-year-olds hanging out with 10-year-olds. Kids hang around each other, right? Especially very soon in schools.
Final question, Joe. I'm seeing that, well, let me put it this way. The data shows, despite what Newdorf said, that in fact, UK infections shot up. I mean, they fell, they went up, they fell for 2 weeks, and over the last month, they've been rising. His data is, or his assumption actually is incorrect and contradicted by the data. And what I'm seeing now on social media is doctors and nurses, again, as they were in the last wave, in utter despair as the hospitals fill up and the ICU wards fill up. And they're worried that, I mean, the latest wave is not even close to peaking. And are we going to see the Alberta healthcare system, especially the acute care system, once again be pushed to the brink of collapse?
Yeah, we already have a demoralized group of healthcare workers. We have nurses that are retiring or moving to other jurisdictions because they're feeling the moral outrage of having to deal with a preventable illness. And also, the government's still pushing this 3% wage cut on nurses. Why would you stay here if you're having to deal with moral outrage as well as financial hardship? It's hard to see unless the government starts to be proactive on this issue. It's hard to see how this is going to turn out well.
Joe, thank you very much for this. Really appreciate your insights.
Thanks for having me on.